What's up, beautiful people? Another day, another study. In the US, ultra-processed foods accounts for 58 to 70% of dietary caloric intake, depending on age group. Kids tend to eat more than adults, and 89% of added sugar intake. And we know that diets high in ultra-processed foods are low in fiber, lower in protein, and lower in beneficial micronutrients such as polyphenols and flavonoids and other things from fruits and vegetables. High intake of ultra-processed foods has been associated with increased risk of cardiometabolic disease, frailty, depression, cancer, and even all-cause mortality. This study was interesting, so it examined the relationship between ultra-processed food intake and thigh muscle fat infiltration using MRI in people who are at risk of osteoarthritis. And why is this interesting? Because the infiltration of muscle with fatty tissue is a sign of muscle health. It's a metabolic marker. And in this study, there were 615 participants, 65% were overweight, 24.2% were obese. The percent of ultra processed food of daily caloric intake was 41.4%, so below what your average American is intaking. There was a linear relationship in the BMI adjusted and the abdominal circumference adjusted model. So for each standard deviation increase in ultra processed food intake, there was a zero point 0.1 standard deviation increase in the grading scale that was used on these MRIs for intramuscular fat. So this means that diets that are higher in ultra processed foods were associated with greater thigh muscle fat infiltration, and this was independent of sociodemographic factors and dietary caloric intake. And this is in line with previous evidence suggesting that substituting isocalorically ultra-processed foods with NOVA criteria class 1 and 2, so whole foods or minimally processed foods, saw a reduction in truncal body fat and body fat, and a small reduction in weight. Even when the calories were the same between the two, the only difference was one was ultra processed, one was whole or minimally processed. The relationship was far more pronounced when it was adjusted for abdominal circumference than for BMI. And interestingly, previous evidence has shown that obesity impairs postural stability and slows gait, and thus changes the functional component of walking. I just thought that was an interesting aside that they mentioned in the study. Either way, this is another study that shows harmful associations with higher intake of ultra-processed foods. It's one of the first things I do when I'm working with patients is try to get them to eat a nutritional pattern that consists more of whole or minimally processed foods. By minimally processed, I mean things that are like pre-cut or frozen. We use a lot of frozen fruits, a lot of frozen veggies, and our dietary plan, it makes it super easy to cook and make meals when you have like a screaming 14-year-old who is your little taskmaster complaining that you're not making their food fast enough.